Hi, this is Laura Schreiber, one of the clinical coordinators for Solutions Staffing, and I also have Linda Reed, the other clinical coordinator for Solutions Staffing. And today we wanted to go over what is remote practice, and is it something I'd like to try? So the reason that you have been sent this is you've expressed interest in working in remote practice. And we wanted to talk a little bit about what that is. So if you have a passion for working at full scope, for working in community health programming, participating in community and cultural events, remote nursing encompasses all of these things, and it might be a really good fit. So we're going to go over what are the requirements for remote practice, what is remote practice, what are some of the differences between this kind of nursing and what you might be used to? And what might a typical day look like? And why might you want to try this type of nursing? So the first thing that we want to talk about is sort of the difference between certified versus non-certified. And Linda, maybe I'll let you kind of speak to this part.
Absolutely. So in 2010, the former CRNBC came out with certified practice, and this was just to sort of bring remote practice nursing to a certain standard, I guess, additional education and certifications and such. So the BCCNP has registered nurses, and then registered nurses with certified practice. So certified practice nurses have done additional training. So they have that special designation through BCCNP. And what this does is it gives us a more expanded scope on what we can do. So we can independently diagnose certain conditions, for instance, a UTI. Then we can independently dispense medication to treat those conditions. I would be able to then dispense antibiotics to treat that UTI without having to get a doctor's order. We can also order some very basic diagnostic lab work as well. So it's more of an expanded scope than a regular nurse. Non-certified practice is what we would call a regular nurse or just registered nurse. They don't have the additional training, so they don't have the additional scope of practice because they're not certified. Of course, in BC, as we all know, nurses need to work to within their scope and not above it. There are certain medications that nurses are able to dispense while working in remote practice, things like over-the-counter medications and such without a doctor's order, but it is more limited. And of course, non-certified nurses are not able to order lab work.
So if you're interested in working in remote areas and you don't have your certification, Solutions does offer the ability to take on one of these positions if you meet some certain initial requirements. And the minimum requirement for working in remote practice communities as an emergency nurse are 2 years working in emergency with your BCLS, ACLS, TNCC, and CTAS. You would need your transportation of dangerous goods and the Indigenous Cultural Competency course.
And the reason we're able to offer remote practice assignments to experienced emergency nurses is the fact that there aren't enough remote practice nurses in BC, and quite often there's vacancies, and we want to be able to maintain a baseline medical thing in these communities, and so we're able to sort of backfill with emergency nurses. But it's a really awesome opportunity to just try this type of nursing and see if it is something that you would like to do and progress on and get the additional training to be fully certified.
And so if it is something that you did an assignment or two and you thought, oh my goodness, remote nursing is something that I want to continue on with, there is a requirement for obtaining required certifications over time. So what these are your remote nursing certificate, and that's through UNBC. Your sexually transmitted infection management is offered through BCIT or the BCCDC. Contraceptive management through BCIT, and those three together result in you having a remote certified practice designation. Beyond that, you would also need vaccine handling and storage, your immunization certification, your controlled substance course, basic suturing, pelvic exam and PAP course, and there may also be site-specific courses required in addition to those above. So that's a lot of certifications, and why would we need so many of them? The reason is because the RNs in community are the primary healthcare provider on site. In these isolated communities, physicians and nurse practitioners will occasionally come in and out and do clinics, but they're not actually on site. So you and possibly only one other nurse are it in regards to a large majority of the health services that are provided. So what are these services? A lot of times nurses coming into remote practice think that the majority of what they may be doing is emergency services, but that's not actually the case. A large portion of what the work involves is primary care. And we'll get into a little bit more detail about this further on in the presentation, but we're talking about advanced health assessment, management of acute conditions, and coordination of care. Probably about half of what remote nursing is public health and community health. So these are programs like running the chronic disease program, immunizations, prenatal care, healthy living, and of course there is the emergency care component as well, which broken down into three parts you could look at as stabilization, treatment, and medevac if needed. And maybe Linda, I'll let you speak to the primary care piece.
Primary care. So I should also mention that remote practice, like Laura said, we're the primary health providers, and so these tend to be mainly in First Nation communities that tend to be quite isolated. So there could be a 4-hour drive to a facility, or they could be just a fly-in or a ferry to get into and out of these communities. So primary care is almost like working in a doctor's office. Patients come in, we use our advanced assessment skills to give them a thorough exam, try to come up with what's going on with them, differentials, that sort of thing. If you have scope of certified practice, then you can treat certain things, and if not, then you'd be consulting with a doctor to obtain an order. There also is a lot of follow-up and coordination of ongoing care if you need to sort of try to arrange appointments for patients, going out for specialist appointments and such. But the main thing is that the nurses are a very key role in bridging the care between patients, families, off-site providers, such as nurses and NPs. So we're sort of it's a lovely area in the fact that you're really able to advocate for your patients and improve their quality of life.
So with the community and public health programming, this involves well-child exams and immunization clinics, prenatal and postnatal care, school health programming. You might be going into the schools and doing sex education, immunization clinics. We run chronic disease programs, so this would be things like diabetes, hypertension, rheumatoid arthritis, and healthy living programs including PAP testing, contraceptive management, and STI testing and treatment. And emergency. So this is, like I said, sort of the third piece that we look at. And Linda, did you want to take this piece?
Yeah, so and this is why we're selecting emergency nurses. So, it's sort of for the after hours emergencies or emergencies during clinic time. And it is just like working in an ER. You would, assess your chest pain just like you would in an emergency. The limiting thing is that there are no doctors. You're having to consult over the phone. There's limited equipment. For instance, no X-ray or CT scanner, that sort of thing. You've got a limited amount of medication, still the basic emergency medications. And sometimes there can be difficulties with medivacs due to weather conditions, time of day. Sometimes there's no lights on the landing strip for the medevacs. They can only come in during daylight hours. And so there are some challenges with that. As, and as well, you're on call. So you're on call after hours for these sort of emergencies.
And so apart from the sort of clinical aspects, there can be another whole layer to living and working in remote places. And there can be some unique challenges, such as Linda mentioned, many of these assignments are in First Nations communities, so different cultures. It's not always easy to get supplies in. There might not be grocery stores. You might have to plan ahead and pack your food in with you. Being stuck while on call. So if you are on call, that means that you have to be by a phone. And if you're in a two-nurse station and you're rotating first call, second call, you need to be available. So it can mean that you aren't necessarily able to explore as much as you might in an assignment when you're not on call. It's a bit of a fishbowl in small communities. You are a guesting community, and it's one of the things where you will leave work and you're still the nurse in community, even if you are off hours. You may be one of two nurses working in community, and there aren't any physicians. So what would a typical day in the life of an outpost nurse look like? 8:30, you might have a patient come in with a bladder infection that you assess, and then you would follow the clinical guidelines for consulting and treatment, and consulting the physician or NP. 9 o'clock, 2 children come in with ear infections. 10 o'clock, an elder might come in who needs a medication review and reconciliation. 11 o'clock, one of your prenatal patients comes in for her prenatal care, which we do very similar to what a woman would have at a physician or midwife's office, their prenatal care checks. At 1 o'clock, when you get back from lunch, you have someone come in who is having a heart attack and you need to medevac them. But thankfully, the day is good weather and the medevac's available and you manage to get them out quite quickly, because at 2, someone comes in who needs sutures. At 3, 4 children come in for immunizations. And at 4, a man comes in with pneumonia, and you have to make a decision on if he is able to stay in community, if you need to send him out. And at this point, you have a ton of charting to do. If you do that, you go home, you're on call, and at midnight, you get a call from a woman who is going into preterm labor. So I've certainly had days like this. Linda, I imagine you have as well.
As well, yes.
Yeah. So yeah, this just kind of gives you a bit of a snapshot of the variety of things that you might see in any given day. As working in remote areas, you wear many hats. So you will be immunizing, you'll be doing the primary care, medication reviews, you might be teaching at the school or even in services to the elders at an elders luncheon, emergency care, fix it. I have been called on to try and troubleshoot generators not working. There's sometimes a musical component, which we will talk about shortly, and birds, not always, but sometimes. So working in isolated areas means there is never a dull moment. The best things about being an outpost nurse, there's so many. Being able to work to full scope as a registered nurse, an opportunity to use skills you wouldn't necessarily otherwise, such as suturing, getting to experience communities and different cultures, constant variety, working with some really amazing teams, and the occasional immature bald eagle in your waiting room. This actually happened in a clinic that I was working in. One of the community members found an eagle that was covered in oil and brought it in for assistance, because that is what the clinic is in these communities. It's where people come for assistance, even if that means the occasional bird. This particular bird we got cleaned up and sent out to a rescue center to be rehabilitated. And I will let Linda speak to these two pictures.
Absolutely. So I'm cutting up a moose up north. So there's lots of opportunities to participate. This was a community event. They were going to have a big potluck supper. And so, of course, food gathering and food sharing is very important in all these communities. And they're very happy to have me and teach me how to cut up some moose. Check out those ribs. Another opportunity I had was I played the fiddle, and I was able to go to the school and do a music demo for the children. I feel that coming into some of these communities, maybe people had never seen or heard a violin live. And so it's a way of giving back to the community, doing some community building. It's nice for the children to see nurses not as just the ones that they come in and get their immunizations from. It was a lot of fun.
That's such a good point about not just being who gives you immunizations. Yeah, it's awesome to be able to get out and yeah, be known as a human. So if we've piqued your interest about working in remote practice, if after this in-service you think, yes, this is actually something that I do have the minimum requirements for and I'd like to know more about, let your recruiter know, and they will arrange a telephone call with one of us, clinical coordinators, and we will discuss it in more detail, as well as we will email you an information package on how to go about getting those extra basic courses that you would need before going on your first remote assignment. And I think that's all that I wanted to mention. Linda, is there anything else you wanted to add?
Yeah, let's see, I work both emergency and remote practice, and I really enjoy the remote practice. I just feel I have more time to spend with the patients, able to connect more, advocate for them, and it's a lot more autonomy. And so that's a very nice aspect, to be able to utilize all sorts of registered nurses skills that you don't necessarily have an opportunity to do that. I enjoy the public health portion, I enjoy the community health portion, and I certainly don't get to do that in emergency. So, but then, of course, I bring my emergency skills with me as well. So it's a really nice way to expand yourself and to, I don't know, try a different career path.
Yeah, that sums it up nicely, I would say. Awesome. All right. Well, thank you for watching our in-service, and we hope to hear from you soon.